name is LaShawna Cooper and I'm a student physical therapist assistant. Today I have my patient Kristen and I'm going to instruct her on how to do airway clearance, postural drainage, and breathing strategies. Are you ready, Kristen? Is this okay with you? Okay, so first we're going to start off by huffing, which is very important for these exercises. So Kristen, what I want you to do is just breathe really hard, almost like you're trying to fog up a window. It's called huffing. It's like this. Can you perform that for me, please? Amazing. Let's get started. Now that I have my patient in the correct position, I am going to perform posterior drainage. So I'm going to perform this to the lower lobes of the superior segment, which is up here. So first I will start off by doing percussion, which is just clapping like this. And I will do this for 3 to 5 minutes. And I'm going to do it from the top of the back on the tip part of the scapula, near the tip part of the scapula. So like this. And I will do this for 3 to 5 minutes. After I've performed percussion, I will then have her to take 5 to 7 deep breaths. And then after she exhales, I will shake her each time. So Kristen, can you go ahead and perform 5 deep breaths for me? Shake on the exhale. And after she does this 5 to 7 times, I would politely ask her, Kristen, can you please turn away from me, please? And I want you to inhale one more time, and on the exhale, I need you to huff for me. Okay, now we're going to perform some diaphragmatic breathing. Normally, whenever people are out of breath, they use their accessory muscles to help them breathe like this, which is not good for them. So what I want to have Kristen to do is demonstrate breathing from her diaphragm. So what I want you to do is just place a hand here so you can feel it. And I want you to make your hand go up and down instead of breathing from up here, okay? Can you perform that for me, please? Deep breaths. Great. Okay, so now, Kristen, I'm just going to perform some quick stretching. So what I'm going to do is place my hand on your diaphragm whenever you breathe in. I'm just going to press down, and it's going to help tighten those muscles to help you to help it contract, to help you breathe better. Okay. So if you can go ahead and breathe deep, have deep breaths for me. And go ahead and deep breath again. And breathe out. I'm just going to press down. Okay, Kristen, can you just sit up for me? So now we're going to perform some pursed lip breathing. And what this is, I'm just going to have you breathe in through your nose and then breathe out through your lips controlled, almost like you are blowing a candle or blowing someone a kiss. So it's going to be like, whenever you're doing this, I want you to breathe in, but I want you to take more time breathing out through your lips. So can you perform that for me, please? Deep breaths, breathe out. Yes. You're doing a great job. Breathe in slowly through your nose, out as long as you can. Great job, Kristen. Okay, now I'm going to instruct Kristen in airway clearance. So what I'm going to do is have you do some different type of breathing, and then I'm going to have you turn to the side and huff, and this should help you breathe better, clear that airway out. So are you ready to get started? All right, so first I'm going to have Kristen to breathe normally for 10 seconds. Can you go ahead and breathe normally for 10 seconds for me? After this, I will instruct her to take 4 deep breaths. Okay, Kristen, after the 10 seconds are up, can you take 4 deep breaths for me? And after she takes her 4 deep breaths, then we're going to go into normal breathing again. All right, Kristen, can you go ahead and go into normal breathing again since you are done with your 4th deep breath? We're going to do this for 10 seconds. And after her 10 seconds is up, I would say, hey, Kristen, can you take 4 deep breaths for me one more time? And on that 4th deep breath, I would have her to turn, can you please turn away and huff for me? And if the airway isn't cleared, I would have her huff again, please. And if it's still not cleared, I will start this whole routine all the way over. After her airway is cleared, then I'm going to go ahead and tell her, Kristen, you can go back to normal breathing. All right, Kristen, now we're going to do deep breathing with our upper extremities. So while you're sitting, I'm going to have you go ahead and perform a motion almost like you're doing the wave, and it'll help you to open up your thoracic area. And so then it'll help you breathe better. So I just want you to, on the inhale, come up like you're doing the wave at a football or basketball game, and then exhale on the way down. Can you perform that for me, please? So we're inhaling and exhaling. Great job. So now can you lie down so I can show you how to do it in supine. You can perform the same motion or you can go in like this, just as long as your upper extremities are coming up to open up that chest. So can you go ahead and perform that for me, please? Same thing. Yes, perfect. Great job, Kristen. Okay, now I'm going to help Kristen cough. Sometimes patients may have a hard time coughing. So what I'm going to do is have her take 4 deep breaths, and then on that 4th one, whenever she's exhaling, I'm going to apply pressure around the ribs, really firm, and then it should assist her cough. It should help her cough. So let's get started, Kristen. Okay, so since this is your last one, can you turn your head for me, please? Same inhale and exhale. Great.